When you are not part of that shared decision-making, you just feel like an object, not like a person. You feel powerless. It's so important because everyone has to be a part of it.
Because it becomes a level playing field, right? You're actually part of the conversation. You are more likely to, stick with the treatment. The shared decision-making is, it's a winning formula. It really is. Welcome to Beyond the Count. I'm founder and CEO of ITP Australia and New Zealand and your host, Danielle Boyle. This is a space created for the ITP community by the ITP community, where we share real stories, expert insights, and everything in between. Whether you're living with immune thrombocytopenia, supporting someone who is, or just curious about what life looks like beyond the bruises and the blood tests, you're in the right place. So whether you're driving, out for a walk, folding the laundry, or just sitting back and tuning in, let's dive in and go beyond the count. In this episode of Beyond the Count, I'm joined by Barbara, ITP patient, President of the Italian ITP Patient Association AIPIT, and Vice Chair of the International ITP Alliance. We discuss shared decision-making in ITP, and we explore what it means to be involved in your care, how things are improving around the world, and why being part of the conversation can make all the difference. Let's get into it. Barbara, when were you first diagnosed?
I was diagnosed with ITP when I was 4, and I was just a child. And for me, it was really very traumatic experience, both for me and for my family. Even though I was a small kid, I still really have a vivid memory of that moment. I remember my mother crying, and it was very difficult for us. First time I was hospitalized, it seemed that my ITP was cured. But then I had my relapse and my ITP became chronic. And for my parents, it was very difficult to find the balance with all these ups and downs, with platelet counts in and out from hospital. And for me, it was a really hard childhood. But here I am. Yeah, it's a long way. For me, it was it's a long time that I'm living with ITP. And when were you diagnosed, Danielle?
I think for myself, I was lucky that I presented at the local emergency department of my hospital for chest pains of all the things in the world. And they took a random blood draw and told me that I had a low platelet count and that I possibly had ITP, and to come back on the following Friday. It was crazy. It was really crazy. I was 39. I was fit. I was healthy. I was told that I had this disease that I'd never heard of before, and that I'd been experiencing bruising, bleeding gums, a lot of the symptoms for a very long time, but just thought that it was me. I bruised like a peach. I just, it wasn't much of an issue until I was diagnosed. I came back on the Friday going, yeah, whatever, like this is not really anything to worry about, and ended up being hospitalised for a number of days in the oncology ward with some clearly visibly sick people, and it really scared me. I was really scared, and then started on steroids, which were just, for me, horrific. Just the side effects and the impacts of the family as a whole. My son was 12. My daughter was in her late teens. My husband was trying to keep us all together as a family unit without me, while I was going through this horrific diagnosis and vast education of this disease, plus working full time and those sorts of things. So, it was really hard. It was really challenging. I remember early on in my diagnosis, there were options. There were definitely options available, but because I was uneducated in the disease, I didn't know what to ask. I just sort of sat there and, sort of absorbed all the information. And when you're newly diagnosed, you don't know what you don't know. You're sort of a little bit dumbstruck and sort of deer in the headlights sort of situation. And you're sort of just hoping that you're getting the right treatment. I was lucky enough, I went on to a clinical trial really early with my journey, but I was lucky I was diagnosed by one of the best in Australia. So, how has your care changed over the last couple of years? Like, have you noticed that shared decision making has started to become part of your journey?
Yeah, actually, the change started about 10 years ago when TPOs became the treatment options for ITP. Well, I noticed further change after the quality of life issues of ITP patients started to be addressed. When ITP becomes chronic, the relationship between you and your physician is very important, and it's a very important aspect of the care. But until we actually started to look into the real burden of ITP, and there were no 15 years ago or 20 years ago, we really had not so many treatment options. And there was not much to discuss with your physician. You were just trying to survive and trying to find some kind of a balance. So yes, last 10 years and every year, I can see improvement in this field. So new treatments took us to talk about what is quality of life, what are side effects, and all the other things that actually are part of the care of the patient.
Talking about quality of life, I have started to see, the shared decision making really weaving its way through, not just for ITP, but right across the health system here in Australia. But yeah, there's still pockets that it's still becoming available, becoming part of the norm. But it is definitely improving, and there's always going to be room for improvement, especially when it comes to shared decision making. It's an education, it's a process, but there's definitely improvement.
Yeah, one of the things, there is a really big difference in how you are treated by physicians that have big experience with ITP compared to the physicians that don't understand what having ITP is. So this space for improvement is really, really huge.
It's true. And being a rare disease as well, we can't expect the clinicians to know absolutely everything about all of the developments either. So, and that's why it's important to have a shared decision making, because as patients, we learn so much more about our disease. So it's got to be a two-way street. It's an education, it's a process, but there's definitely improvement. It is definitely getting better.
And in your opinion, since you had this experience as an adult, what is the impact on patients when there is no shared decision making?
I've seen it. And I've spoken to patients who have been given ultimatums to having treatments or find another doctor. That shocks me. It really shocks me that it's still happening. That sort of stuff is happening today. While I understand that ITP isn't a common disease, it's a rare disease, and not every hematologist that you come by, especially from adult hematology, not every doctor is up to speed on what's happening in the world of ITP, and that's where a lot of the information sort of falls down, and a lot of the shared decision making sort of goes out the window a little bit. So I've seen some really bad and poor experiences. On the personal experience, I really early on in my diagnosis, and this wasn't my clinician, it was somebody else that had sort of come in left of centre. I was on steroids. At the time, I had aches, in every joint possible. My husband was having to carry me around the house, and my doctor, I called the hospital, and the doctor who answered and took the call turned around to me and said, "Look, don't be so silly. You're fine." And I was completely dismissed. So that wasn't a conversation. It wasn't, I just felt stupid and like I didn't know what I was talking about. But through patient associations like yours and mine and the Global Alliance, I think we're really starting to make some change in that area as well, which I think is really important. What about you? What do you think?
I don't know if it counts, but when I was a child, nobody asked me anything about decisions that were took for me. And anyway, in that time, it was not usual to ask for patient preferences. And as you said, in being informed is very important. At the time, my mother was not informed. She didn't know much about ITP because there was no possibility to learn like we have today. And as you just mentioned, in order to take part of the shared decision making, you have to be informed. And my childhood experience is actually, perfect example how you feel when you are not part of that shared decision making. You just feel like an object, not like a person. You feel powerless, and it seems that your needs are not important. You feel ignored. And if you have to go through the treatment, you don't understand, and it's hard, and it's very hard to stick to the treatment. And also it makes you feel very, very frustrated.
Did you find as a kid, with ITP that you were sort of being talked about in the room and not necessarily involved in that conversation? The doctor was talking to your parents and not you at all?
100%. But, for a child, it's quite understandable. The tragedy sometimes is that actually it happens also with the adult patients. So this is something where talking about shared decision making, it's so important because everyone has to be a part of it.
Thanks to our sponsor Sobi for their ongoing support of ITP Australia and New Zealand and our podcast Beyond the Count.
So tell me your experience. What is the impact?
Yeah, the impact is just it's such a positive experience that your concerns are validated, you're listened to, and they're actually hearing what you're saying. It's actually going in and it's actually becoming part of, okay, so if Danielle experiences X and her goal is Y, well, then this treatment may not necessarily be the right one for her. Let's have a chat about it anyway to make sure that what I'm thinking as a clinician is correct. Let's have that discussion. And then, we go down this path instead. When it comes to TPOs, there's so different delivery systems, and, what's right for one person may not necessarily be right for the next person. And, you've got to have those conversations and those open conversations because it becomes a level playing field, right? That, you're actually part of the conversation. You are more likely to, stick with the treatment or, actually take it properly, or, it's not as bad of a journey as what it could have been with increased anxiety, mental health issues, and all of these other things that, people living with rare disease are more prone to experiencing. The shared decision making is, it's a winning formula. It really is. What about you? Have you had any experiences where it's worked really well?
Yes, actually I do, because when you feel that the chosen treatment is part of the open discussion, you feel it like your own. And as you said, you stick on it, you make it work. I had a really bad relapse with my ITP in 2018, and my hematologist suggested to me to start with TPOs. And I was quite worried about possible bone marrow side effects. And I really was afraid that something would happen to my bone marrow. And my hematologist, he was so excellent that he understood that was my emotional part talking. And he gave me space to, calm down all my fears. We talked really a lot. He took his time. We talk a lot about all the fears I had in order to activate my rational brain and actually to look into the figures and to look in the numbers that actually show the possibility of having that side effect and to understand it in a way that it has to be understood. Because, treatments do have side effects, but you have to understand them and understand the numbers that actually support approval of that treatment. So, yes, this is, I was really happy, and I'm glad that my hematologist actually understood very well what shared decision making is, and he took me on board, and afterwards I was really comfortable in having my treatment, and I really had an excellent results. So I have to thank him for that. But Danielle, what do you do to focus on shared decision making during your appointment?
So I write questions down. I use my phone. I've got a brain like a bit of a sieve. I can't retain anything these days. And the older I get, the worse it's getting for me. So if I don't write it down, it doesn't happen. If I don't understand something, I constantly ask questions until I do. I just ask for plain speak. Stop talking to me like I'm a doctor. I don't know what you're talking about here. My doctor draws diagrams for me at times as well, which is actually quite helpful. I'm a visual person. I actually ask him to spell words for me as well, so I can go back home and have a look at those words and learn a little bit more about my own disease as well. And I just take the time and I ask him to take the time instead of that 15 minutes. You've only got this allocated amount of time. He doesn't rush me. And I also don't try and rush him either. As much as I love my doctor very much, I've taken him off the pedestal that we all just assume that all doctors know everything. They don't, and he can't read my mind. I can't read his mind, so I ask the questions. No question is a stupid question. These guys have done years upon years upon years of education. We haven't. And every question is valid. And I've also had a really good discussion with both my GP and my hematologist, saying, look, these are my goals. I want to get to a place where I can travel. In the next 6 months, these are the things that I want to do. How do I get there? What's the plan? What's the discussion for me to get there? But it's just about having that open dialogue. I think that's really important. If you've got a good relationship with your healthcare professionals, it is easier.
Yeah, I completely agree with you, because this relationship of trust, mutual trust and openness is really the base of everything. I like to prepare myself and get informed about new treatment options, even though maybe I don't need one. But I like to inform myself before the appointment, and as you said, to have clear in my head what actually my goals are. And I do ask lots of questions, just like you, because if it's my nature. If I don't understand a thing, I just can't stick to it. So that's the reason why I prefer to feel sometimes even stupid in asking a question than not asking the question at all. I like to prepare myself and to write down. I'm a little bit old-fashioned, so I use still paper to write down my questions and doubts and thoughts. But there are apps that can help with that, and also there is ITP discussion guide that actually can be a useful tool in order to prepare for the appointment.
Do you have any suggestions for clinicians to help them prepare for shared decision making as well, conversations with their patients?
I think the very important thing is to actually check if the patients did understood what was explained to them. To ask them if they have directly, what are your doubts? Do you have some preferences? What do you think about my proposal? How do you feel about it? And, understanding that actually we have that emotional part and then we have that rational part. This is something that I know it's hard and a lot to ask for physicians and hard to do. But actually, understanding with which part of ourselves we are communicating in that moment, it's quite important, because the the response of the physician or how they will present what they need to discuss with patient changes. Also, it is important to understand that patients need time to digest the information we get. Especially if there is a lot that was discussed, it's really useful to give some time to digest everything. And maybe, in my opinion, it is very useful to give patients opportunity to reach out to you, or maybe even to contact them to ask a few days after the appointment if they have some further questions or further doubts they would like to discuss. I don't know if you agree with that.
Oh, I do. I definitely agree. It's just really understanding and caring, listening to patients when they come in. I know you mentioned earlier about the emotional and the rational side of patients. I know personally I'm an emotional person, and when things are terrible, I'm an emotional mess. I feel so sorry for my doctor when he has to, see me when I'm not at my best. He's really calming. He uses plain speak. He talks to me calmly. He also encourages me to bring a support person, because if I can't hear everything and I don't have the capacity to absorb everything that's being said or discussed, he generally says, bring somebody along, because that person is not in that emotional situation, and they're more likely to be your rational side. So you can recall, you can go home, you can digest, you can discuss, and making sure, especially when somebody is not necessarily responding well to treatment, check in, but also make sure that they've got somewhere to reach you if something goes terribly wrong terribly quickly. What's the plan? So then that way they've got that reassurance that if something does go bad, that there's a bit of a safety net there for them as well. And, just having that open dialogue, which is really important, and plain speaking. Clinicians have been, and our healthcare professionals have been, working and being educated in these fields for many, many, many years. You are just learning about this disease. So be kind to yourself as well, because if we don't stand up for ourselves as patients, we're not going to have that opportunity to have that two-way dialogue with our doctors and other healthcare professionals around us as well. What about you? Any top tips?
Yeah, the major one is to prepare for your appointment, because time is precious resource for you and also for your physician. And getting prepared will get you to get the most of that appointment. And, ITP brings lots of anxiety and stress in your life. And even small things like getting prepared in order to know that you will address all the doubts and fears that you have will take away a little bit of that anxiety that you have. And if you actually have difficulty in connecting with your physician, that's fine too, but you have to address that issue too in order to fix it with your physician. But if you truly can't get that connection and support you need, maybe you should consider also finding someone else, because ITP has lots of impact in our everyday life. And I think that we as a patients need to do whatever we can to relieve a little bit this burden of ITP and be the part of the most active part of society that we are in. ITP brings lots of anxiety and stress in your life, and even small things that can help reduce that stress and anxiety actually will improve your care and your life with ITP.
Very true. Well said. I hope you all got a lot out of today's episode. Before we wrap up, here are 3 key takeaways from today's episode. 1. Write down your questions before appointments. Whether you use your phone or notepad, having questions ready helps you stay focused and ensures you don't forget anything during your visits. 2. Be honest about your goals and concerns. Tell your doctor what matters most to you, whether it's reducing side effects, travelling, anxiety, or something else. This helps shape a treatment plan that fits your life for you. 3, use tools like the ITP discussion guide or shared decision-making toolkit. These resources can help you feel more confident and prepared to take an active role in your healthcare. A big thank you to Barbara for joining us today. It was an absolute pleasure. If you're looking for support, join the ITP community at itpanz.org.au. While you're online, check out the latest edition of The Count, our quarterly magazine. Read some of the great patient stories we have in our news section. Download a huge range of treatment information, guidelines and more in our patient resources section, and know that you are not alone. We are here to support you. We are here to provide you and inform you with all of the latest information when it comes to immune thrombocytopenia. If you found this episode helpful, please share it with others in the ITP community, and don't forget to leave a review on the platform you're listening from. It helps others find Beyond the Count. We've got more expert conversations coming your way really soon, so hit the follow or subscribe button to stay updated. And thanks for tuning in and diving beyond the count with us.